All right, why don't we go ahead and get started? I'm so excited to welcome you here today. Thank you for being with us at the Southeast MHTTC session, Sustaining School Mental Health at the State Level. This is going to be a panel discussion. It's part of our series, Sustainability of School Mental Health Initiative. We did have a wonderful nuts and bolts session if you'd like to get kind of the lay of the land for what are key elements to longevity of your school mental health initiative, tools, resources, templates. We covered that in January, and Andrew will share with you in the chat a link to the resources that we made available, as well as an archived recording of that session. Today's session, I'm so excited about. It's a little bit of a shift, and we are looking at real-world examples of how sustainability happens, primarily at state level, but really looking at cross initiatives and over time. I'm going to introduce our guests shortly, but before I do that, I wanted to introduce myself and the team at the Southeast MHTTC. My name is Dr. Christina Borbet, and I am here today with the Emory University team supporting the Southeast MHTTC. If you are not familiar with your Mental Health Technology Transfer Center network, please get familiar with us. An incredible resource to the entire mental health field, and a particular resource to the school mental health field. The Southeast region is supported by Emory University Rollins School of Public Health, and I want to express gratitude to the team that's supporting us in bringing everybody together today. That's Andrew, Sarah, Tara. Thank you so much for your support. I believe we're also joined by our Southeast MHTTC School Mental Health Director, Janet Cummings, today. And we get to be here with you and provide this to you at no cost, thanks to SAMHSA, the Substance Abuse Mental Health Services Administration. They are making this resource available nationally. So all of the resources from all of the centers are available to you. And today we're providing resources that we intend to be responsive to needs that we've heard expressed in the Southeast region. And one of the key ways that we're able to bring you this no-cost content and provide topics and formats that are useful to you is by gathering some information in a survey. And so at the end of each of our sessions, we count on you all to complete the survey. It takes like 2 or 3 minutes to click through some questions, and it ensures that we can report back to SAMHSA based on their requirements and secure our continued funding. So I'll be reminding you about that as we approach the end of our 90 minutes together, but I did just want to let you know that taking the time to complete that survey is really instrumental in us being able to continue this work with you. So let's take a little bit of a look at what we are trying to do together today. We are hoping to learn from other states' examples of design and implementation of long-term school mental health prioritization. So again, really drilling down to what does longevity look like in real life? We want to adopt or adapt sustainability practices that will contribute to the longevity of our own school mental health initiatives. And we want to advance systems transformation approaches that establish school mental health policies and practices as the standard. So a lot of this, as I mentioned, is going to be at the state level. But I want to remind you that a lot of the best practices, a lot of the lessons learned, and a lot of the rich experience that you're going to hear about from our panelists today translates. It translates to wherever you're doing work, whether it's a community-based organization, whether it's at the district level, school level, regional level. And so we're really excited to have all of you here today. I want to give a particular welcome to our SAMHSA funded AWARE grantees. All of our panelists today have AWARE experience. And so they'll be addressing that, but weaving it into some of the other initiatives that they've been engaged in for school mental health in general. So we'll just start with a really brief introduction to what are we talking about when we're talking about sustainability. And then we're going to spend the bulk of our time together with our guests. There will be time for discussion, question and answer, and then we have a little bit of wrap up before we move on. So again, we have a 90-minute session, and at the end, we'll have plenty of time for your questions. I'll be hosting today, so if there are questions that you'd like to ask our panelists or comments that you'd like to make, requests for follow-up in terms of references or resources that you hear about, please don't hesitate to add them to the chat. But towards the end of the session today, we are really hopeful to be able to have some open dialogue. So we'll be inviting folks to raise their hand and unmute to engage with our panelists. So that's our plan. I'm just going to give you a quick sneak peek for who we get to engage with today. We have Pat Sanborn from Health and Wellness, the state coordinator at Nevada Department of Education's Office for Safe and Respectful Learning Environment. We have Maribel Simra, Director of Student Services for the Virginia Department of Education, and Monica Caldwell, Director of Mental Health at Rise Wisconsin in Madison, and the former State Education Project Director of Wisconsin's Project Aware grant. So I'll do a little bit of a deeper introduction before each panelist joins us. But before I do that, I wanted to go ahead and make sure we're all on the same page when we're talking about sustainability, because it can mean so many different things. So let's just breathe into it, right? Here we are. You arrived today because the word sustainability probably caught your eye, and it probably conjured up some tasks, some responsibilities, potentially some overdue things on your to-do list. And when we think about sustainability, I want you to just take a moment to consider what pops into mind. I'm going to rest on that for a moment. The most common answer that I hear when I ask people what they think of when I say sustainability is funding. So let's just clear the air on that one. Yes, sustainability has to do with funding. And that's a key part of it. It's not going to be our focal point today. We have addressed it, and we do have resources available if that's the thing that you want to drill down on. But today, let's talk about it at a meta level for a moment before we dive into our real world examples, because I want to see if we can kind of shift our thinking, shift our paradigm. When we think about sustainability, we're thinking about the longevity, the long term, the marathon of the work that we're doing. And oftentimes that is a statewide initiative. It can be a particular program. It can be a particular policy. And so we are often thinking about this idea that sustainability is keeping what we have and holding on to it for the long term, keeping things the same, keeping things in place, making sure that we have those predictable cycles of programs or funding, that we are thinking about things in terms of this is the protocol, this is the procedure, this is how we do business. And if that's our prize, if we're keeping our eye on the prize and we're aiming to keep things in place for the long term, it can feel overwhelming. There's so many variables, there's so many changes and transformations that can knock us off balance if that's what our goal is in terms of sustainability, is keeping things the way they are all the time and for always. What I want to do is have you kind of think about sustainability from a slightly different perspective. I want you to think about sustainability as, what are the impacts that we want to make available to young people? What are the key outcomes that we want to ensure in terms of access, in terms of impact, that we want to make sure are available for our young people right now and our young people of the future? And if we shift to think about that, if we think about instilling values-based decisions, if we think about instilling some flexibility and some adaptation, then it changes our mindset so that we're not so connected, we're not so grounded in this idea that it has to be the same staffing, it has to be the same leadership, it has to be the same program, the policy has to be implemented the same way. It gives us some more flexibility to innovate, because if we think about our goal being a particular resource or a particular access or a particular support in order to achieve mental health and wellness for our young people, in order to achieve thriving youth in schools, it gives us that ability to kind of grow, adapt, and shift as a strategy that is part of longevity. And we're not continually chasing the next shiny object, the next shiny object, the next shiny object. We're creating a space where there's fluidity, where there's opportunity for transformation as needs change, as leadership changes, as staffing changes, as funding changes, but we keep our eye on that prize of the outcome that we're trying to achieve for our youth. And so that's the lens that I'm bringing to sustainability. Again, we kind of are consistently thinking about it in terms of the nuts and bolts, right? The who's doing what, when, and how. But these are just kind of some shifts in that sustainability paradigm that can help us recognize what we already have in place, and then kind of create environments, create climates where sustainability doesn't feel like a long laundry list of to-dos in terms of securing funding to keep doing the same thing all the time and always. So I just wanted to lead with that to give everybody kind of another way, not a different way, but another way to think about how to approach this work in the long term. I'm going to pause there with my introduction and turn it over, because our priority today is to hear from folks who are doing this, are committed to doing this, are experiencing it real time and willing to share what that looks like, because there's ups and downs and all arounds when it comes to doing the long-term work of school mental health initiatives, including in state level infrastructure. And so our first panelist is joining us from Nevada. I want to welcome Pat Sanborn. Pat is the Health and Wellness State Coordinator at the Nevada Department of Education's Office for Safe and Respectful Learning Environment. She has worked for over 20 years coordinating and managing federal and state grants focused on school mental health and wellness, including Safe Schools, Healthy Students, School Climate Transformation Project, and Project Aware grants in California and in Nevada. Her work with collaborative state and community partners continues to sustain Nevada's quest to improve student mental health and wellness. She holds a master's degree in psychology and organizational development from Sonoma State University in Rohnert Park, and she currently resides in Carson City, Nevada. Pat's joining us today, but from off camera, and I'll be advancing Pat's slides. So Pat, welcome. Thank you so much. I'm so excited to have you here with us. And please, please let us know, what does sustainability mean for you?
Thank you, Christina. Appreciate being here. It's wonderful to see all of my colleagues here as well. And so good morning or good afternoon, wherever you are. So what does sustainability mean to me? And while you were talking about that, Christina, I was thinking one of the very first things I learned early on when I coordinated the first Safe Schools, Healthy Students grant that I had is that they drilled into our heads, sustainability starts in the beginning. So typically a lot of people might think like, okay, you have funding, and then we'll think about how we can sustain that in year 4 or year 3 or in the last year of the grant. We have plenty of time to put things in place. But one thing that's really important and that I learned is that that is something you think about from the very first day that you get your grant, or even prior to that while you're writing your grant. So thank you for mentioning what does it mean to me, because that is something that's stuck in my head all of these years. Next slide. So I think one of the most important things that you can do to sustain your work is to establish your collaboration and integrate the practices that you're putting in place. So I'm just going to give you an example of some of the grants that I've worked with over the years and some of the partnerships that I've developed along with colleagues in order to sustain the work. So our Safe Schools, Healthy Students grant here in Nevada, we got that grant in 2013. And we are still able to sustain some of the strategies that we put in place over the years. Not in all places, but sometimes you have to just be flexible with what you're able to do. And so that the Safe Schools, Healthy Students kind of morphed into a Project Aware, which we first got in 2014. And then again, we received another grant in 2020. And there's where you start with your sustainability, starts from the very beginning. And then at the same time, we had School Climate Transformation Grant also began in 2014. So we were able to take our School Climate Transformation Grant and our Project Aware work and integrate the practices that were common to each of those grants into the communities that we were working with. And then now we have a school mental health services grant, which I believe my colleague is on this webinar, who manages that project. And this is a recruitment and retainment of school-based mental health professionals, which is really, really critical in this time of the pandemic. In coordination and at the same time, we established some partnerships that work with us as a state agency to keep some of our practices in place and sustain the strategies. So we have a school mental health partnership, which is basically some of our school district, school-based mental health professionals, the counselors, the school psychologists, school social workers, that we meet with once a month. So our state, the state meets with the district staff, and we're able to communicate what are their needs and what can we help them get. So we advocate internally for how we can support them and use their feedback as the people who are doing the work in order to establish any policies that are put in place or support policies in their favor. Then we have a Medicaid partnership, which is working with our state Medicaid agency and to sustain the practices of billing for Medicaid, which is really important when you're talking about school-based mental health services. And we've had that for quite a while, for probably 6 years or so. And then at the national level, we belong to the Healthy Schools campaign, which anybody can join, which is also states that come together once a month in order to share their strategies on how they're able to sustain their or get into place their Medicaid practices. And so all the while we're thinking about, okay, so there is this funding that you have to sustain, and Medicaid is one of the ways that you can sustain some of the work you do over time. And we have a partnership with our Child and Family Services at our Health and Human Services. And then for 2 years now, we've been involved with the COIN, which is a collaborative improvement and innovation network that is sponsored by the School Mental Health Center, the National Mental Health Schools. I'm sorry, the National Center for School Mental Health and the National Health Alliance. And so through this project, we are able to, what it does is for improving and quality improvement of your school-based mental health programs. And they use the SHAPE system, and any school or district can join the SHAPE, and you can put in your data, and there's all kinds of resources there. And then we also belong to the LEAP, which is the Leadership Exchange for Adolescent Health Promotion, which focuses on sexual health education and safe and supportive schools, which can include a lot of different things. And then lastly, we have shared funding streams that we've established fairly recently between our Division of Public and Behavioral Health, and they provide some coordination and some staff through different funding. So we've been able to integrate the work that we're doing on behavioral health and the work that we're doing with schools in order to sustain some of the work that we're doing over time. Next slide. So another method for sustainability is to work with your legislatures at the policy level, because that's where you really get to sustain things. Once it's in state law, then there is a mandatory requirement for schools or districts to comply with those policies. One of those policies is our school climate survey, which back in 2015 was established in state law that all schools and all districts had to do a school climate survey. And so we've worked with a vendor to customize our school climate survey for grades 5 through 12. And so once a year, they receive a survey, and each of our districts can report on several components. And so that's how we can determine what kind of needs they might have, or where they're, whether it's school safety, where they might need extra support in getting their numbers up. Then also that coordinates with the School Climate Transformation Grant, which is to, mostly it's, we use it for MTSS or PBIS. And so we work with our university on that grant and to provide our MTSS training across the state. We also have within our education department state improvement plan, which has a whole section in Goal 6 that covers social emotional learning and includes mental health strategies for improving student health. And of course, many of you may have also used some of your ESSER funds to improve social emotional learning and mental health through that priority. And the same thing with our Department of Health and Human Services. They work with us and have integrated some of their funding to match what we have with NDE, so that we're not duplicating, but we are actually enhancing sustainability and programs. Okay, next slide, please. Sorry. So when we talk about systems transformation, there are several things that might go into establishing a system, and how can you change that? Transformation might mean a quick change, but really it takes time to do real transformation. And so by doing all of these things, eventually things will shift. And so I've just listed out some of the policies that are currently in place in Nevada. I don't want to go through all those. When you get the slides, there are links on the next slide that that you can go directly to our Nevada legislature, and you can read the whole text on what is currently in law. But I'm just going to highlight a couple of the places where I'm more familiar with. So in 2015, in SB 515, as a response to bullying, our legislators put into place a law that gave block grants to districts to hire school social workers. This was one of our really big wins, I'll say, in that over the last several years, excuse me, we were able to build our school mental health professionals and to help our students. And it's been invaluable over time. Another one I want to highlight is, which I talked about, which was our Nevada STIP, as we call it, State Improvement Plan, which highlights specifically some social emotional learning strategies and mental health, and why it's important within the state policy. I'm going to highlight SB 89 in 2019 focused on, it's a really huge bill, and so there's lots of different sections, and it focused on school safety and school climate and increasing our SISP ratios, which are the specialized instructional support personnel, more commonly known as school social workers, school psychologists, school counselors, and nurses, because we all know how very important nurses are in student health, and especially their mental health also. And then in just this last session that ended in June of 2021, SB 151 establishes Washoe County increase the ratios to the national associations of each of those professions recommended ratios. And so we know that that's going to be a long term for a while, because we're way below ratio in most of the places, but our state legislators are pretty much focused on the two largest districts to have more school-based mental health professionals per student in the schools in support of not only their learning, but also this pandemic that has kind of put a lot of students back in their learning. So that is our big one. And then I'm just going to skip over the others, but you can look them up if you're more interested in the substance abuse legislature. As I said before, some of the practices are our annual mandated school climate survey, which goes every year to every student in every school. I got a duplicate here. Then we also, not only for the students, but this year, I'm so excited, we're going to be putting in place a school climate survey for the staff. So these are perception surveys. And so what we're going to be able to do once we have the data for all that is to compare the perceptions of students' safety to the staff safety and find out, where are the gaps and what do we need to close those gaps. We also have some data integration practices that are currently in process and hoping that we can work better with our larger districts in accessing the data that we need to see in order to improve services. And then, of course, we have some shared projects with our evaluators on our grants so that they're more familiar with the work that we're doing across the state, not only in the one particular grant or one particular project. And I think that's all of my slides. And the next slide does have the references, so you will be able to click on those and find out more about any of those. So that's all I have for you. Are there any questions?
Pat, I am sure there are questions because you covered such an extraordinary range of, especially the policy-based approach to ensuring longevity. I didn't see any particular questions come in the chat. I welcome them, but I wanted to know if you could just briefly clarify in terms of the policy approach to ensuring that these types of resources are available. I was curious about the state laws. So for example, you mentioned the school climate survey, and I wondered kind of what the approach was to funding allocation. So do those policies come with dollars? And anything you want to say about what it was like to achieve that?
Great question, Christina, thank you. Actually, the school climate survey did not come with dollars, at least in the very first few years. So fortunately, we did have our Safe Schools, Healthy Students project when it first came into play. And then we have our Project Aware, and we have School Climate, which each of those federal grants were able to contribute to the cost of implementing that school climate survey. Now, I believe in this most recent session and with ESSER funds, we've been able to, we're using those ESSER funds to fund the school climate survey for students and the school climate survey for staff, which we're putting in place this year. So
that's helpful. Thank you for the
yeah.
And then my other follow-up question on the, just as, because I think the school climate survey is such a great example of how states can build in this idea that there's value in the data that helps drive decisions around supports and services for young people. And so my follow-up question is about the data. So if this policy is in place, and I'm not intimately familiar with the policy itself, is there a mechanism by which the schools or districts are reporting the data so that data can be compared across communities or compared to state level?
Well, in relation to the school climate survey or any
Yes.
of the data?
Well, I was asking about the school climate survey as an example, but if you have other examples, I'm open to them.
Yeah, there is a free version of the school climate survey that any school or any district within the state, the the country can access through the U.S. Department of Education. And so ours is mirrored upon that. So because there are some differences in our survey, and I don't know that we can measure it against other states.
But within your states, are districts required to report the data at the state level?
Yes, we actually receive at the State Department, we receive the data directly from the evaluator who's pulling the data together, implementing the survey and giving us the results. And so each of those districts that are, all of the districts can access their own data on a website, and they can compare to other districts within the state if they choose. And so, yes, sorry, I think I misunderstood your question, but yes, we can compare the data between within the state on the school climate survey results. Yeah.
Really helpful. And Pat, so I know there's going to be more questions and we'll have opportunity for discussion at the end of the session today, but I just want to acknowledge, how much incredible creative work you're doing to kind of put all these pieces in place. And one of the things I want to underscore for our audience today is what I heard is that it didn't all come together at once.
Correct.
So even just in the example of the funding that this policy, which I'm sure was a marathon in and of itself, went into place, and then the funding has kind of been built from different angles and through different resources over time. And so I wanted to just underscore that for folks to recognize that it doesn't have to all the pieces don't have to fit together perfectly in the same shape forever and always for it to be progress towards integrating these important elements of school mental health, or really creating a pathway for longevity for these school mental health initiatives. So Pat, thank you for sharing.
Yeah, and I will just say also that not only is it one thing, but it's not only one person either. And that's why I stress the importance of collaboration and partnerships within sustainability. It's probably the primary way you're going to get things done, because no one person can do anything alone.
Well, that is a beautiful segue to our next guest that I'd love to introduce, who I have met through a network of incredible champions and collaborators around school mental health, and that is Maribal Simra. Thank you so much for being with us today. And let me make sure I can pull this slide up here. Yes, so we have Maribal with us. She's the Director of Student Services for the Virginia Department of Education. She has dedicated her career to advancing the healthy social, emotional, behavioral, and mental wellness of all children. With over 20 years of experience in the field of education, Maribel has served as an early childhood special educator, school psychologist, and administrator in a variety of settings across Georgia, Florida, and most recently, Virginia. She currently serves as the project director for Virginia's State Personnel Development Grant and Virginia's School Climate Transformation Grant from the U.S. Department of Education. Ms. Simra received her BA in psychology from Emory University, yay, and her master's in education and education specialist degrees in school psychology at Georgia State University. Thank you so much for being here, and we're so excited to hear about the work that's happening in Virginia, Maribel.
Oh, thank you so much for inviting me to be part of the panel, and I'm very excited to share with you the work that we are doing in Virginia. But before I get to the Virginia work, I did want to really quickly comment on some of the work that Pat mentioned, because I just wanted to say that I really agree with the importance of leveraging policy. And she did such a nice job of sharing what has been done in Nevada around that space. And even though it's not included in the slides that I'm about to share with you about Virginia, I did want to share kind of our story around, which is similar on our school climate survey development, because it's a good example of many works of how we end up with policy when things things start more like a practice. And our school climate survey effort started, gosh, I don't even know, maybe 7-8 years ago with an IES grant where we received some funds to try to implement and develop a survey. And after that, getting some results, we were able to share the results with public, use it in some of our evaluation measures and other grants. And because of that, that caught the interest of stakeholders, of educators, and most importantly, legislators. So soon after that, we saw beginning attempts to pass legislation related to having a statewide survey of school climate in Virginia. And we were able to, like Pat in Nevada, leverage some of our existing funding at the beginning to pilot that survey. And due to those efforts, we were eventually able to have that become not just a pilot, but law for the entire state. And after a year of implementation, happy to report that it was added to the budget in Virginia as well. So now we have a state-funded school climate survey statewide. But again, these are efforts that take so many years, right? And it's that eye on the prize, that sustainability. I think Pat spoke to it. Doing your work with the end in mind is extremely important. And I think that that's what Virginia has been trying to do as well. If you don't mind advancing to the next slide, please, Christina. In terms of our sustainability work, I would say that and in line with keeping our eye on the prize, I think it is really critical that you identify priorities to keep your focus on. So I know mental health and wellness, it's something that it's not just the state educational agency is focused on. We know our LEAs are focused on that too. We have our partner agencies in Virginia that are focused on this. We have nonprofits, we have community providers. Mental health is an area of huge interest and focus, especially right now due to COVID. And one of the things that we find to be particularly helpful in ensuring that the initiatives that we have are able to stay true to the test of time is to make sure that we have very clearly articulated priorities around where is it that we are headed, where is it that we want to go with our mental health work. I will say that these priorities are not static. They may be tweaked and they may be changed over time, given what our current context is. You know, obviously COVID created a little bit of shift. Post-COVID, I'll tell you, we added that last bullet right there in terms of the need of focusing mental wellness on our adults as well as our students. But it does give us a place to align our work. So when I think of sustainability, when you posed that question early on, my first thought was cohesion and alignment, and the need to really make sure that any initiatives that are put forth from the state level are really supporting that larger vision, whatever that may be for your state or for your particular environment. You know, here I share with you what our priorities are at this time around the provision of mental health and wellness supports. So I'll go through these quickly, and then what I want to do is share a couple of the major examples that we have in place. First and foremost, we know that it is really critical, especially post-COVID, not post-COVID because we're not quite post-COVID yet, but during the time of COVID, perhaps I should say, to enhance supports at the universal level. And we are focusing on that through the implementation of social emotional learning as well as trauma-informed strategies. We're also very focused and have a number of initiatives around increasing staffing levels of our school-based mental health providers. And I'll go a little bit more in depth about a couple of examples of those that we have in place. And then our other two priorities are one, we know we can't support mental health alone. It's not just the job of the schools to do this, and we really need to strengthen and leverage those partnerships and collaborations that we have with our families and communities, with other providers and agencies to do this work. So that has been an additional area of focus for us. And again, like I mentioned, the provision of supports to the adults that are charged with caring for our children. Next slide, please. So I am going to start out with probably one of our major efforts around which we align most of our mental health initiatives. And this is our alignment to our multi-tier system of support, or MTSS framework in Virginia, because we love to put our names on things. It is called the Virginia Tiered Systems of Supports. And a couple of reasons why this makes sense for us. I mean, with honestly sustainability being the primary driver there, is this idea that we've been working on this integrated academic behavioral system of support for several years. We've had this integrated system since 2012. And in I think it was 2014 through, this is that when we got our first Project Aware grant, is when we decided to integrate that social, emotional, or mental health component into our tiered system of support. The reason why we felt that was the way to go in order to support state level efforts around this work is that we had such a strong infrastructure already in place to provide ongoing training and coaching to our school districts. So you can see on the map that you have in your screen that we have almost half of our Virginia school districts that already participate or receive support from the state to implement VTSS. And what that means is that they are in partnership with us to receive ongoing training at the district level, so for their district teams to create systems to implement a multi-tiered system of support, as well as at the school level. So they have schools that are implementing that multi-tiered system of support. So we had and so they received that training as well as coaching. So we have a network of about 45 state level coaches. They are located in the different regions in Virginia, which are numbered up on the screen. Our training and technical assistance centers are located at different universities, public universities in Virginia. So we have this great network of coaches that are already well poised to provide district level, school level, classroom level support to our schools. So it made perfect sense to really use this infrastructure that we already had in place to build our school mental health supports. That would just make sense in terms of the state being able to support implementation. And it would also make sense from the district perspective in that it's not an additional, for those schools or districts that are implementing PBIS or any other multi-tiered system of support, adding school-based mental health supports is not something additional. It's just something that made sense within the context of how they are already set up to do it. So it just made sense from both that district perspective as well as the state perspective. Can you take me to the next slide, please? Thank you. So here are a couple kind of more concrete products that came out of that work. I will say the first one was really a product out of our pilot, which was our Project Aware funded pilot. We worked with 3 school divisions to develop what does this tiered implementation of school mental health supports look like. The product out of that was a development of what we call the mental health companion to the TFI. The TFI, the Tiered Fidelity Inventory, is a tool that I'm sure many are familiar with. If you implement PBIS, it's a fidelity tool to be used at the school level to measure implementation fidelity of a behavioral multi-tiered behavioral tiered system of support. And that's what VTSS uses to measure fidelity. So we really wanted to anchor, since this is a tool that we knew our districts were using anyway, we wanted to anchor the school mental health work to that. So we created this mental health companion, which basically looks at every item within that tiered fidelity inventory and translates it, for lack of a better word, or puts it in the context of what does this look like if you're implementing that mental health tiered implementation. This is not it is on our long list of kind of future or long-term desired objectives to eventually go through evaluation of this tool per se so that we can use it as a fidelity tool, but right now it's really designed as an action planning tool. So our districts that used our mental health companion do not use it to score fidelity because it's not validated to do that, but they do use it to enhance their implementation efforts and to create a roadmap for what are some of those areas that they need to focus on in order to have that comprehensive system. Couple of additional products that came out of this work is our revamp or redoing of our universal training to really embed trauma-informed practices within that universal approach. So most of our schools that had already gone through our initial what I will call school-wide PBIS training, we enhanced all of our trainings to make sure that we included some trauma-informed strategies to better align to that mental health companion of the TFI. And then we created some asynchronous modules to allow for, again, and this is another thing that I will point out is really helpful when you're thinking about sustainability. We are trying to create products that districts can continue to use time and time again to provide support to their own school teams and teachers. So creating of, all these trainings have like training manuals for the trainers. We have now developed asynchronous modules that can enhance the training, or you could even do the training on your own. So just really thinking about how is it that I can support, not just provide this training, but support the provision of that professional learning from the district level to their schools as time goes on. Just basically trying to work ourselves out of a job. We also work really closely with our family partner in VTSS, Formed Families Forward, to create some professional learning that is directly directed to families and parents to ensure that they can have all the knowledge and necessary to be able to support the tiered system implementation of comprehensive mental health supports in their schools. Can I get the next slide, please?
Yes, Maribel, I'm going to move you forward, and we do just have a few minutes left. Before we move on to the next one, I want to tell you there's a clamoring of interest in your mental health companion to the tiered fidelity inventory. So if you have any other comments about whether that would be available to share, there's an interested subset of folks out there who would love to hear about it.
Yeah, so I can, it's actually not linked to this presentation, but I'm happy to share a copy of it, and I will, Christina, make it available to you that you can share it with the entire group. Oh, no problem. Okay. Gosh, no, we certainly, this is the kind of stuff we're here for, right? Sharing with one another, and yeah, we don't need to reinvent the wheel if it can be helpful to anybody. Another of the strategies that we're really focused on, I'll go through this one quickly because I want to get to the next one before my time is up and I tend to ramble on and on, is our social emotional learning efforts. And this is actually a pretty direct result of some state level policy that kind of came about in 2020 that directed the department to develop some social emotional learning standards. So those are new for us. They were disseminated to our school districts last year. But one of the things that we do to help support and sustain implementation of this over time was really focus on ensuring that all of our guidance, our training, our any kind of implementation resource that we have in place is actually aligned to our tiered system of support. So again, as we are sharing out resources with our districts, we know we have our state level trainers or state level coaches that are then available to make sure that they can support that implementation because everything is aligned with our existing infrastructure. And then I linked a couple of additional resources there as well. We can go to the next slide. And this is another really big one that I wanted to share with you in terms of sustainability for our school mental health efforts. This particular site, this is a result of a couple of grants that we received from the U.S. Department of Education. And kind of like Pat's example, this is something that we were really focused on ensuring that we had a product that was left to serve all of Virginia after the end of the grant. So though the grants themselves are really targeting specific districts, the product that is coming out of them is something that we're going to be able to use and are using already with the entire state, which I'm really excited about. So you have a link there to our Virginia Student Services, the Career and Learning Center, or our CLC. I put a QR code there as well if you want to snap it with your phone, although it looks like Andrew is already putting the link in the chat. Thank you, Andrew. I appreciate you. So this is our single point of contact site that it is designed to do two things. One is the one place that you can go to get information about licensure to become a school-based mental health professional in Virginia. So one of the things that we found is that there's an awful lot of confusion between the licensure that might come from the kind of behavior or the Department of Health Professions side versus education. So we have one place now where you can get information. We have one place where all school districts are able to post open school-based mental health positions, which is also really huge. And then we also have one place where we have online training available for all of our school-based mental health professionals, and that's this site. So I encourage you to explore the site and use the site. You're very welcome to use it. It's not just for Virginia. On our grant side, one of the things that we are exploring, and I know we're short on time, so I'm not going to go through kind of the details in the next couple of slides that speak more specifically to our retention and recruitment strategies that we are using with the participating LEAs. But one of the things that the site allows us to do is that it really allows us to target some of the professional development that we want our target LEAs to focus on. So for example, a district might be able to decide that they want all their staff really focused on trauma-informed strategies. For example, for this year, they can select and choose from some of the content that we have available and assign that to their to their staff members. So we're piloting that with our existing, with our participating or partner LEAs through these grant, which is 7 LEAs in Virginia, though we do expect to expand this to everybody once the life of the grant expires. And yep, so I think I am going to pause, and there's some of the retention activities as well, which again are also supported through our site. So we don't have just the professional learning modules. We're creating a digital badging system that can help kind of reinforce learning by providing badges and earning incentives for completing those badges. And then we also have like discussion boards and community of practice that can convene within that platform to help, again, support implementation, because we know that one of the biggest reasons why our school mental health providers leave the profession is lack of support. So because of that, we provided many opportunities to support that through mentorship as well as the community of practice. So gosh, I feel like I could talk forever about this, but I am gonna pause right there.
Yeah, I feel like we'd love to have you talk forever on this, Maribel. It's just fascinating. And I know, we're opening up lots of different cans of worms here that people are really resonating with. And so we might need to just have this entire panel back again. I want to just ping you, Maribel, maybe in the chat, you could follow up with Bryn, who has a question about that mental health companion piece to the TFI and how it differs from the ISF. And so I'm going to leave you to chat about that, hopefully in the main chat so that everyone can benefit from that. But I want to move us forward because we have even more in the realm of what's possible when we're thinking about longevity and how it comes into play. I'm really excited to introduce someone who's been an incredible mentor to me in this field, Monica Caldwell. Monica leads and supports innovative mental health programs at Rise Wisconsin in Madison. That's a nonprofit. She's formerly the state education agency project director of Wisconsin's Project Aware. She brings 35 years of experience in schools, mental health, and child welfare, remaining passionate about high quality services and supports for youth and families living with mental health challenges. Monica believes that collaboration and collective care can change the trajectory of our children's system of care. Monica, I'm so thrilled to have you with us today and to share some of the lessons learned in your vast experience addressing school mental health, including for the long term.
Well, thank you so much, Christina. I wanted to start by acknowledging the sisterhood, which is the people who helped shaped my leadership in the Wisconsin Department of Public Instruction. From 2014 to 2019, I was the state director of Project Aware, and Christina Borblay and Leora Wolf-Prussian and Wendy Velos and Joyce Sabian, who was under the call, and all of these, and Elizabeth Waitzig of Change Matrix. These are women who made an investment in me, in our Aware team at the time, in some of our state leaders, and said, hey, leadership matters. Leadership matters. How you approach this gig that you signed on for is really important. And, you know, we do a lot of complaining about when our bosses get in the way. Been there. But what do we do to really support leadership in these innovative efforts, whether it be a grant or a school mental health initiative? How do we bring along really good skills in the people who are identified as leaders? And I use that loosely. So I want to thank the women whose shoulders I stand on, who got curious with me about coaching, because guess what? I walked into that job in 2014, my first state job, and I said to my boss, so like, what's the model here for consultation and coaching and leadership to local districts? Like, how do y'all do it? And he's like, I don't know. You want to write one? I'm like, oh, I've been here 15 minutes. Come on now. And so I had the support in the grant from our TA providers who said, can I show you something here that might be useful? And that's where adaptive leadership kind of walked into our world in Wisconsin, is that the folks came to us and said, would you like to learn about a model that might be really useful in school mental health initiatives and in grants, grant leadership as well? So I'd love to spend some time, if you're cool with that, talking about adaptive leadership specifically, and sort of the impact that it had on our initiative in Wisconsin. Next slide, please. So what is adaptive leadership? I'm going to just say it to you in a sentence, and I'm going to say it twice so we can just linger. Adaptive leadership is the practice of mobilizing people to tackle tough challenges and thrive. So it's the practice of mobilizing people to tackle tough challenges and thrive. So wow, that gets your attention, right? When you're trying to move new work forward, is that we know that that change is hard. Like, we're in the business of change. I'm a school social worker. When I was listening to Maribel talk about like what she's doing to support the profession in Virginia, I was like, oh, that's amazing. But when we're in the business of change, it turns out it's still hard for us. Like, we like the concept of it, but change is really challenging, and it needs to be respected and honored. And adaptive leaders in particular wrestle with values and purpose and process, right? So adaptive leadership really focuses not just on the technical aspects of checking boxes, but instead it has more of, we're invited to have an experimental mindset, like that focuses on iterative change, you know, culture change. Like, we did TSS, trauma sensitive schools in Wisconsin. We did SEL, we did mental health stuff, and we had all of this great content, but we still have to invite people to the table to learn, to be open, to make mistakes, to have an iterative process and change. Like, somebody said, hey, Monica, you're in charge of $10 million. I'm the first time a social worker ever had that kind of money. And so I'm thinking, well, there's going to be a lot of excitement in the local districts to spend this money and innovate for kids. And I was so naive, because change is hard and change needs to be respected. So I needed a model. I was sort of really in a place where I was like, hey, I need to be coached on what leadership and coaching and consultation actually is. And so some people stepped forward to offer this to me, and I want to give it right back to you today. So we know that leadership generates loss. Like, people have to give up something in order to change. And adaptive leadership as a model tackles that question directly. So when you come in all excited and you're like, I got the money, I'm hiring people, this is gonna be awesome, we're gonna put new screeners in place and it's gonna be amazing. And people are like, yeah, no, you don't get us. You don't understand our local district. You don't know what we're going through. And you get this resistance and you're like, but I'm so excited though, right? And so adaptive leadership gave me, anyway, and I'll tell you how we sort of shared the wealth of this in Wisconsin, a model for approaching local districts in a way that was truly collaborative and respectful. And most importantly, honored change. Because leadership is not about making a better argument, folks. It's about engaging the hearts and minds of those around you. And that's a whole different deal. And so let's take a look. Next slide, please. So the principles that are listed here on this slide literally were on a Post-it on my computer screen. Like, I'm not even playing. I said, these are the things that are going to keep me focused in this darn big grant, and I'm going to model and coach at the local level and with my state colleagues what adaptive leadership can really be. And I'm going to step through that with you, but I really mean it. Like, it was a Post-it on my desk, and it was transformative, not only for me, but for the local districts, for our state colleagues, because we had some common language to talk about the leadership challenges. We had to deconstruct the great man theory, folks. Like, leadership is not, I have all the answers and I impart them to you, like, you know, like stones. I hand them down from the hill. That's so old fashioned, but yet the pressure that leaders feel in education is still some of those things. I have to do it all myself. I have to have the answers. And we really wanted to deconstruct that. So adaptive leadership offers that. You'll see that Ronald Heifetz at the bottom there. I don't have any hyperlinks, but that's the book. And so if you're interested in this to get your attention, I would say run, don't walk. Because I read that book chapter by chapter, and I read the notes of it, like I took notes on it. And in this day as a nonprofit mental health director, these are the same questions I ask myself every day to inform leadership. So it's very flexible model. So what is it that I'm all excited about here? Okay, so you decide. Put your critical thinking hat on and see if this fits for you. So the first thing that you're asked to do in an adaptive leadership approach is to get on the balcony and look down at the work in a way that allows you to see multiple perspectives. You know, just shifting around up there, it's windy up there, right? And you're looking down, you're not on the dance floor anymore, you're up on the balcony looking at patterns, observing staffing, observing where your priorities are. Are we resourcing those priorities adequately? Do we have our eye on the prize, as the other fine women have brought up? And if you're on the balcony, it's a little windy, bring a friend up there. It's cool. It's no problem. Bring somebody up there to sort of do that, but get some distance. And you know how hard it is for school leaders and nonprofit leaders like me to get some distance when the grind of the work is so hard. It's right here every day. This is my work right here. So getting up on the balcony to look down at the patterns and with some distance is really beautiful. It's an important first step. And then when you're looking at the work, you need to look at whether the work is technical or adaptive. So technical work is important. It's time sensitive. It's things like resolving problems that have a pretty straightforward solution. You set up a new structure, a new policy, a new procedure. Those are technical things that, when unresolved, really is hard on people. It's so hard if these things get stuck and they're not fixed. But my focus today are more of the adaptive challenges, and they can only be addressed. The adaptive challenges are the sticky wickets, folks, the things that, like, why aren't we able to move this initiative forward? Well, my guess is because there needs to be more attention to people's priorities, beliefs, habits, loyalties. This is the hearts and minds parts of the work. So, we were looking at, we had all this money in the local districts, and we're like, hey, you can do restorative justice, you can do TSS, you can do mental health, you can do all this stuff. And there was some slow uptake, and staff was hired. And I'm like, well, what's getting in the way of being able to move forward? And there were some adaptive challenges that were really, really important that we were not addressing. So you can't insert money, insert program, and push it. It does not work. You're going to get the yes buts, and you're going to get people standing still. It's just human nature. And so an important question is, in the adaptive phase, when you're identifying the adaptive challenges, is what do we stand to lose with this change? Like, what do people have to give up? So if we're going to develop something new, is it a threat to people's competency? Do they feel like a little unsteady if we make a change? I liked it the old way. If I make this change, I won't interact with my colleagues in the same way. I won't have that meeting that I enjoy so much every week. Like, we have to think about what else is in play. And then what are the essential values or history or wisdom or core competencies or identity that must be preserved? Like, so there's part of you that wants to shift and make new things happen, but there's also at the same time the desire to hold on to who we are, our wisdom, our identity, the things that we truly value. There's tension there. It's a both and. So you hold the change while at the same time, and this is how I was coaching local district leaders. Like, what's getting in the way? What do people stand to lose? What is it that you need to preserve? Because this is what you're proud of. This is what your community stands on. So ideally, we want to get folks to a place where they're in the discomfort of change that's a productive zone. Like, the people are a little unsteady, but they're not too far out of their zone so that they can say yes to a new idea, trying a trauma-sensitive strategy in a classroom, looking at your discipline that's so exclusionary right now. You have to get people to yes on that, right? And so if you ask those questions, what do you stand to lose if we make this change? And what do we need to preserve? If you ask those in tandem, we're getting at some of the same questions that Christina started with on sustainability. It's a parallel process, the questions that we're asking in adaptive leadership, which is why I found it to be such a good fit with these initiatives. So when you know that change causes discomfort, the next thing you see there is supporting a holding environment. And that's this idea of creating a container where people can meet and talk about what's hard. Expecting that stress is going to come. Do your leaders have the facilitation skills to hold an environment where multiple perspectives are valued? So you're telling me you want leaders to be able to do that? I'm like, yes, yeah, I think that's important, to be able to convene people and hold multiple perspectives when tension comes up. So that's one. So another practice in adaptive leadership, other than a holding environment and managing conflict, distress, is being able to share the work and give the work to others. And that was a question we were often asking ourselves. Are we sharing this work early on in the grant? Because if it's just staying on the grant team, it's not going to live on. We need to bring others to the table throughout. And are we engaging all voices, including those that are protected? Those like kids with lived experience, parents with lived experience, people out there trying to get services for the kids and they can't. Are we protecting, some of our voices, like the school tech secretary, who holds so much? It's an example of somebody who might not be invited, but she knows everything about the families in the district. Are those voices included when you're developing an initiative where care and concern and mental health is a priority? I mentioned regulating distress. Just no change is hard, and then maintaining disciplined attention. Oh my goodness. The shiny pennies that are really fun to chase. Wow, I love a nice shiny penny myself. If there was one thing I could do as a do-over, when people wrote their plans for these really lovely grants, if we could have had more of a laser focus and done things well, as opposed to 16 different trainings, 17 different trainings, and not really having anything stick, more is not always better. So maintaining disciplined attention is really important in adaptive leadership. And that's again, is something I keep on my desk in the nonprofit world right now. Am I staying focused on the quality measures that really, really matter? Or am I wanting to be seduced by a shiny penny? And believe me, I'm always looking for the golden Willy Wonka candy bar, but it ain't out there, right? It ain't out there. What the real work is what I'm describing here in adaptive leadership. Next slide, please. So these are just quotes. How did I, so yeah, you could tell I'm a little excited about this, but what did I do with adaptive leadership in Wisconsin? Let me tell you. So when I was being coached this way, I was like, wow. And I was modeling it for others and seeing really good tractions at the local level for convening community teams and holding conflict and prioritizing, looking at adaptive and technical challenges. I said, hey, let's convene groups of people to learn adaptive leadership together. And so we held academies on adaptive leadership for state and local leaders. And we convened those academies. I think during the time of the grant, I had 2 state level academies that lasted a year. And these was not only, they were school leaders, but they were also superintendents. I had principals who wanted to come. They were invited, student services staff, and along with state people, we all learned adaptive leadership together, have this common language. And we also include peer specialists. I mean, we had such an interesting crowd. And when one of my local communities was struggling, I did an adaptive leadership academy for about 6 months right in their community with their staff. So essentially it was just bringing forward this little post-it I kept on my desk and creating those kinds of leadership conversations and supporting leaders to be vulnerable and to admit, you know, I need some help here. I need a model. I need a way to think about leadership. So here's what they said. You invested in me as a leader. I was equipped to lead and mobilize. I took my team out to the woods to think adaptively. What is happening here, right? So stepping away from the work to think about it together. And it's not identifying multiple programs and inserting them into a culture that is unprepared for change. What wisdom? And what do people stand to lose, right? So those were all good questions that came up. And just a quick example, I'm gonna wrap up here in a minute or two, Christina. Probably the biggest adaptive challenge that we had was we wanted to do new and innovative things on a staff that was extremely tired. And I can't even imagine what it's like with COVID now. So they were already tired in 2014 to 19. And it was, we shifted our focus in AWARE, recognizing that adaptive challenge and put a lot of resources into adult well-being about midstream. So Wisconsin has a toolkit on compassion resilience for staff because we knew that we were missing that piece on innovation because our folks really needed the support and to be seen and heard and cared for and understood as educators first before they were willing to take risks. And we've got a lot of traction with that. I can put a link in the, if you're curious about this whole adult wellness initiative, I'll go ahead and add a couple things when I'm finished speaking here. Next slide. So we made the same kind of things available at the state level. As I mentioned, we talked about leadership as disciplined experiments and iterative process, right? We talked about the art of facilitation. How do you manage conflict when it arises? And as leaders, can we be supported to figure that out together, not just bury it or make it unspeakable? We also moved from train and hope to implementation. That's a whole nother story, which I don't have time for, but that's an adaptive shift. When you're done putting on the trainings, how are people helped to implement the great ideas that they learned? Next slide, please. So much of the work on AWARE, and I would argue any of you in this room, is about managing change. And if you're looking for ways to look at this adaptively, check out that book, check out Adaptive Leadership online. I think leaders deserve support. And let's think about that at the beginning too, just as we're designing our evaluations and our plans and we're getting our tiered inventories and fidelity tools, ask yourself, how are we taking care of our leaders in this project and what we're up to? And can we coach them so that they have some support to think about how to lead? And so that's what I'll offer today in terms of adaptive leadership. And I hope that you find it useful. Try it on, see if it's good fitting clothes for you. And thank you for your good time and attention. I really appreciate it.
Thank you, Monica. Wow, that was like a condensed work, like 3-month workshop. Thank you. So it's always so inspiring to hear you talk about leadership. And we're going to shift. I just want to let folks know that we are going to shift into Q&A. We have some from the chat. And I want to just cue you so that if you are interested in adding more questions to the chat for our panelists, you can do that. You can also raise your hand. But Monica, I wanted to just land on, as kind of a follow-up to what you're sharing. It's, what do I want to say? I'm just going to say bluntly what maybe comes to mind when we hear about this, which is, and it kind of ties into that train and hope model. You know, leadership feels sometimes like such a squishy endeavor. And so, you know, one of the things that I, you know, your mentorship has contributed to my understanding is that it's not. It can be really concrete and actionable. But how do you make that shift, right? Like a lot of times we're thinking about deliverables and accountability and like how are we demonstrating what we did with the money and, you know, what the impacts and the outcomes were. And so it always feels like widgets, right? Like, you know, people served, trainings offered, you know, participant counts. We talked about GIPRA surveys earlier today, you know, and so shifting to make the case for investment in leadership can be a tough one. And I wonder if you have any words of wisdom for folks who feel motivated and inspired, you know, by what you've offered as a really real life example of what transformed Wisconsin using a leadership approach to sustainability. But, you know, how did you get support for that?
You know, I think it wasn't really that challenging, because when people are invited and included, like, let's say you just said tomorrow, we have an adaptive leadership academy for you that's free. Would you love to feel supported in asking the hardest questions about your job and how you do it? So they scrambled to get the slots, because leadership is lonely, folks. It's lonely business. You've been feeling it. I've got leaders right here in this space. And so when there is the opportunities for convening to talk about leadership with, like you said, a focus on being and not just doing. So you just mentioned all the widgets, right? And I think leaders are hungry for coaching that tells them how to be, how to have a meta structure on approaching leadership in a way that feels manageable. So I guess I don't think it's that mysterious in terms of, I didn't find it difficult to ask and to have people say yes to, and all we asked them to do was like 4 days a year. Like we said, 4 7-hour days, let's convene. And it was very practical. Like we did facilitated environments where they were practicing how to manage conflict. And it was so reinforcing that they started talking about it to other people. So when you have an experience that you can say yes to, it's kind of contagious. Funny how that turns out. So that's why the academy happened twice. And so I guess that my thinking is make if you could create the conditions, like communities of practice, Maribel brought that up. If you in your state wanted to say, we want to have a leadership community of practice where you are supported to be vulnerable, to reflect, to get up on the balcony, to look at your values, what you want to preserve and what you want to, you know, what you want to let go of. I think people will come running. That's been my experience. So anyway, just thinking about leadership, that's what I would offer.
Well, thank you for sharing that. And I want to open it up to our full panel now. We do have a couple questions I wanted to loop back to that came in from the chat. And some of them may have been addressed in part during our panel shares, but if there are other thoughts from any of the three of you, I welcome them. Marjorie was asking about ways to measure our progress, presumably our progress in our work, our progress in our school mental health initiatives. What are ways to kind of measure and demonstrate our progress in terms of tools or reports? And Marjorie, if you wanted to unmute and clarify anything about your question, I welcome you to. And I welcome you, Pat or Maribel, Monica, anything that you have found as a good way to disseminate information about the impact, the value, the progress that you've made in school mental health initiatives.
So I have a couple of thoughts. This is Maribel that I would like to share around kind of measurement or evaluation of this work. my first thought, I think, kind of goes back to the idea of alignment. And one of the things that we've been really intentional to do is to make sure that as we implement different initiatives, that our evaluation efforts, that it's not just the implementation piece that it's aligned, that our evaluation is also aligned. And that has proven to be particularly helpful in using those results to share with different kind of stakeholders, because then we have outcomes from, and I will just use, and you may have noticed, we rely a lot on federal grants, from our Project Aware out of SAMHSA to grants out of the U.S. Department of Ed, like state personnel development or school climate transformation or mental health service professional demonstration. They all have very individual projects that are evaluations that evaluate the effectiveness of the grant itself, but we have one overall big evaluation of the work that is being done around kind of support services, so that regardless of what district you're in, we are collecting kind of the same type of measures and outcomes, so we can answer a number of different questions, and then we can report out kind of based on what the questions are, if that makes sense. So other than the importance of alignment of evaluation, the other thing I wanted to mention is that we discovered not long ago, maybe it's been a year or two, that long drawn out statistical analyses and big manuals of how we're proving that what we're doing is effective doesn't really matter very much to people. So we have really made a very conscious effort to condense our results to infographics, one pager, really highly visual, that just answer different questions. And that has been a huge shift for us on how we report on our outcomes. And we're finding that to get a lot more traction with the public in general and kind of legislators in particular.
That's helpful. Yeah, I feel, as I hear you speak about it, I feel a huge sense of relief that I don't have to compile those massive reports and spreadsheets, but rather distill it down. And Marjorie, I see that you popped up on the screen. Did you want to add anything to your question or comment?
Could you say that again, please?
Oh, I was just inviting you if you had any follow-up questions to your question for the panel.
Yeah, I saw, I copied all of the tools that were posted up here, and I saw that we had a lot that we were using to measure. That's one of our biggest things that we're working on right now, is trying to figure out, do we want to do like a Likert scale? Do we want to do surveys for parents and teachers as well as students? I don't know. Does anybody that we are in our last 2 years of the grant, probably everybody else is. And we're just trying to make sure that we have everything we need in order to be able to move forward.
Yeah, that's such a good question. And one, maybe we can open up a bit. I know Pat started us off by saying, day one is the day that you start thinking about sustainability. And so one of the questions that I, can kind of build onto from Marjorie's question is, well, what should we be thinking about sustainability? And what if we didn't start day one? What if we're starting right now? Any thoughts or recommendations from any of the three of you for what we should be thinking about at the state level, what we should be thinking about the local level, and what if we didn't begin thinking about it on day one, but we're a little bit of a ways in, or we're approaching the end and we need to think about it right now?
I can just add a little bit to that, in that maybe one of the things that you could do is like do a review of some of your state policies at the legislative level and see where you might be able to insert some of the strategies you've put in place, and where they might fit in with current state law. I'm not sure where you're from or when your legislative session comes up, or whether you have any time in order to work with other people to put something in place or to propose a bill, work with your assembly and your senators at the state level. So that's the first thing that comes to mind, is that there may already be some legislation in place that you can kind of hop on board with and find out what who is monitoring that, and how you might be able to find some ways that are common.
Thank you, Pat. Anybody else want to comment on that? And then I think we're approaching a wrap-up point.
Yes, this is Maribela. One of the things that we did not long ago is to really take a look at the various tools and measures that were available in Virginia. And you know, there's some that were in place just because of grants, but there were many that were being implemented either, like Pat suggested, as a result of legislation. Some were not even done by the Department of Education. They may be done by our health department or our Department of Criminal Justice Services in relation to school safety. Anyway, what we ended up doing is really bringing together the different agencies so that we could align and really think about what is the information that we need to know, so we can, one, minimize the burden on our districts, but two, kind of make it more likely that this measure that we have is serving all of these purposes. And once we were able to do that, it actually kind of really helped that being, that's when we ended up being able to get funding, for example, to be able to continue the tool. And this is specific to our climate survey. That's now the climate survey that includes some elements related to from the Youth Risk Behavior Survey, which is something that our Department of Health does, that includes some elements related to our school safety audit that our Department of Criminal Justice Services used to do, and kind of bullying, gang violence, things like that. Anyway, so just really auditing what is available and trying to align those efforts may help yield something else to use.
Thank you. And I want to just give my personal appreciation to each one of you. You have all really been influential in my professional development, and I'm grateful to each one of you for contributing to that. I'm also just an incredible admirer of the work that you do, the way that you show up, and the way that you get creative and roll up your sleeves and stick with it through all of the ups and downs and all arounds in doing this work in the long haul. I definitely feel like we need a part two with all of you to just kind of keep unpacking the incredible wisdom and experience that you so generously shared with us. I want to just assure our participants today that we